More communities and more businesses are telling residents, customers, and employees to mask up. Welcome back to Up Front. A state health official says mask use is becoming more normal and socially acceptable, and that's welcome news in the fight against COVID-19. We're talking now about coronavirus in Wisconsin with Dr. Ryan Westergaard, the Chief Medical Officer and State Epidemiologist for Communicable Diseases at the Department of Health Services. Doctor, thank you for your time. We know you're really busy right now, and state health officials are saying that we are really moving in the wrong direction when it comes to these coronavirus numbers. As you know, the school year is right around the corner. In your medical opinion, do you think that students and teachers should be going back to class?
So that's a good question. And when you ask a medical opinion, we like to base that opinion on some good scientific evidence that tells us what the right thing to do is. And we are unfortunately in a situation where there's not good scientific evidence to say that one strategy is better than the other. There are benefits and risks of having in-person school, having remote school via the internet, and a combination of those. And we unfortunately don't have good science to tell us how do you weigh all those risks against all those benefits. So as a result, a lot of different communities, a lot of different states and school districts are making different decisions. And that's understandable given how little we know about really what the right thing to do is.
And people seem to be loosening up a little bit when it comes to outings, you could say, between 4th of July barbecues. I know that youth sports are starting to begin again. And at the beginning of this pandemic, the health department was saying you should limit your circle to 5 people. What is your recommendation now?
Unfortunately, in this regard, the science has become clearer in that those types of interactions do turn out to spread the virus infection in communities. In the past month, we've seen quite a strong uptick in cases among younger adults and also in adolescents and children. When we do the investigation, it's quite common for the exposure to be social gatherings, including some sporting activities like you mentioned.
And we just had the highest 7-day stretch of new cases since the pandemic started. And you just mentioned that could be potentially because of the community spread and that people are going out and about more. With more of these mask mandates, what do you think that will do to the numbers?
Well, I think it depends on how well the mask mandates, and again, mandates are one strategy of trying to increase mask use, but not the only strategy that people are using. There's quite a mix of communities that are making strong recommendations or public health advisories in the same way that we give severe weather advisories. Regardless of the mechanism of how we encourage mask use, the science is pretty clear that if we could really scale up how many people are wearing masks, we could expect it to have a pretty significant decrease on the amount of transmission in communities. So masks have really emerged as one of our most important tools. And the closer we can get to, say, 90% or higher of mask use in public places, I think we could really see a big difference.
We've seen videos of people getting into fights over wearing a mask, but of course we know that that's not necessarily the majority. Do you think more people are getting on board with this in Wisconsin?
It seems like it to me. Part of our work here at Public Health is to have a lot of conversations with business leaders and local public health and school departments. And so through those conversations, just kind of taking the temperature of communities, it does seem like there's encouraging progress toward this being accepted as a new normal. But it's hard to really say that with a lot of scientific certainty. And some people still do feel quite strongly about it. So I think the story is still being told. I'm encouraged that the science is pretty clearly on the side of more widespread mask use being really a public health benefit. And so I'm optimistic that we'll continue to move to that direction in terms of our shared public opinion.
And here in the Milwaukee area, we're noticing some hot spots spreading outside of the city and to the suburbs. You work at the state level. Is this a trend we're seeing across the state?
Yeah, I think there's a slow burn that's heating up in many areas of the state. Somewhat dissimilar to our experience a couple months ago, where it was really driven by hot spots or focal clusters or epidemics in workplaces and long-term care facilities. We're really seeing now generalized community spread. So a number of people who are becoming infected in communities that don't necessarily have a specific risk factor, don't know that they were exposed to a specific person who had symptoms. So yes, some communities are more affected than others, and those are becoming community level hotspots. But really the trend, unfortunately, is that there's more widespread transmission in most Wisconsin communities.
And Doctor, lastly, before I let you go, just before this interview, when we were chatting, you say that you're concerned that numbers will go up even more. This isn't as high as they'll get. Why do you think that?
Well, one of the most concerning things I heard this last week was that among the increase in cases in our younger population, meaning the people in their teens and 20s and 30s, in those age groups that we're testing, the majority of them are being tested because they have symptoms. So what that means is that we're only testing the people with symptoms. There's a fair number of people who are in the community with infection that don't have symptoms. So another way to say that is we might be under testing right now. And if these chains of transmission continue to people who are older and people who are more vulnerable and more likely to become symptomatic, we might see those numbers tick up even further.
Okay, well, Dr. Westergaard, we appreciate the update. Thank you.
Thanks for all you do. It's good to talk to you.
Thanks, you too. Just a few weeks until the August primary in Wisconsin. Next, what Milwaukee's top election official is doing to make sure this election goes better in Milwaukee.